Hello and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio, and I'm real glad that you could join us for another segment. In this segment, we're going to have a conversation with Ndrew Smith, Chief Operations and Innovation Officer at Vituity and President of Inflect Health. He's joining us on the program to discuss the launch of Healthful. It's one of the first proprietary patient navigation platforms that leverages AI and machine learning to accurately and proactively identify patients who may benefit most from high-touch care navigation. He's also going to touch a little bit on the benefits of Healthful's approach to patient navigation to produce a holistic healthcare journey, addressing such variables like transportation and scheduling that could impact a patient's access to care. Welcome to Health Professional Radio. Ndrew Smith, thank you for taking the time this evening.
Yeah, thank you so much for having me, Neil. Look forward to it.
Well, give us a brief insight into your company and your role.
Yeah, appreciate it. So I work for Vituity, and I wear multiple hats, so I'll quickly summarize that. But at Vituity, I'm the Chief Operations and Innovation Officer, and Vituity is a healthcare provider company. We practice in over 300 hospitals. We have 5,000 clinicians, and we really are focused on meeting patients where they're at in their community and giving them the best quality care we can. Inflect, I'm the president of Inflect, and that is our innovation hub and wing where we make investments, prototype new ideas, and launch new companies. And Healthful was one of those new companies. So I also am on the board of directors for our foundation. But all in all, we're here to improve the lives of our patients every day.
Explain the differences in, Healthful's approach to patient navigation as opposed to some of the other platforms that may be out there.
Yeah, absolutely. Great question. Something we're really proud of with Healthful is this all started with a pilot at Vituity in an emergency department in Chicago. And the idea was that 80% of the patients that were coming into the hospital were walking out the front door and not getting help with all of the follow-up resources that they needed to identify, making sure that they could get the food they needed or shelter or get a primary care visit. And what our pilot was the navigator stood next to the emergency room doctor, saw all their patients with them, and helped follow up with those patients once they went home to make sure they got everything they needed that the doctor wanted to make sure that they actually got. So that turned into many more ERs doing that, many more navigators. And then we realized, wow, this is really different. Like a lot of these patients are not getting seen by social workers or case managers, but have this need. And so what we did was we created Healthful. And then what we realized was we can't just do this with people. We really need to build a technology platform that quickly identifies what the patient needs. So the navigator's spending more time talking to the patient and less going through Google and searching everything. And that's where our ML platform was created.
Is this sort of a concierge type of access to where if a person needs transportation, that's what you focus on? If their care involves nutrition, dietary supplements, things of that nature, is that what you focus on? Or do you have like a package that says, hey, here's a package, pick what you need and leave the rest?
It's more about exactly what the patient needs when they come into the emergency department or they stay in the hospital. We try to custom tailor it for each patient we see. What we realized is some patients came to the ER needing an OBGYN visit. Some people were struggling with addiction or mental health, and the navigator actually creates a custom plan with the physician for each one of those patients. So it's very much tailored to what that patient needs when they walk out the front door.
Does this place more of a responsibility on the healthcare provider to make sure that these patients get what they need? Or do you pretty much take it out of the healthcare provider's hands, not totally, but make it easier for them to give their patients the care that they need?
Yeah, very insightful. So one of the issues when you're a provider in a hospital is when the patient comes in, you take care of them, and then they discharge and go home. It's kind of like going into a black hole, right? We don't really know what happens with the patient. Where are they going? Did they get the things that they needed? Did they get in, if they're struggling with addiction, did they actually go to an addiction clinic? And why this is so important for the providers is they don't have the time to figure all of those logistics out. So the navigators do that and then keep the provider in the loop. So in many ways, it's actually make the provider's job a lot better and a lot more rewarding, knowing the patients are getting what they need, and it benefits the patient by actually getting a real person helping you navigate a very complex health system.
But it's still physician-led, is that correct?
Exactly. Yeah, everything we do at Vituity, Inflect, and Healthful puts physicians in the front line. And that's actually why I work at Vituity. Instead of health administrators and executives innovating, it's actually frontline providers changing the way that care is delivered.
Talk a bit about how Vituity and Inflect Health are focusing on investing. I heard you mention your investment, healthcare investment innovation hub.
Yeah, thank you so much. We really, especially during COVID, realized that we need to meet patients where they're at, no matter where they're at. If they're at home or a family member's home or a skilled nursing facility or a clinic, we can't just expect everyone to come to the hospital. And actually, most people were scared to come to the hospital. And so what Inflect is really set out to do is invest in companies that are changing the way care is delivered through technology, through different care models that meet people where they are, through your phone, through computer, through an outpatient clinic. So everything isn't reliant on the hospital. And the way that Vituity leverages that with our 5,000 providers in 25 states we practice in, we can make that a solution that resonates in each community that we're practicing in.
What type of feedback have you been receiving?
Yeah, we've gotten really good feedback. Each year we invest in 12 to 15 companies. Multiple of these companies have done pilots with Vituity hospitals, which has been super successful, and we've gotten some great outcomes. And honestly, Healthful was one of those prototypes and now has launched and navigated over 500,000 patients. So the outcomes and the energy coming from this are just phenomenal.
Are there any examples, maybe a previous or a future project that you can use as an example for us?
Yeah, so we have a really cool project in our prototype lab right now, which is based on taking care of your elderly parents at home. Okay, so we've created a smart mirror and an app with a health coach, and that you would give this like to my grandmother. My grandfather passed away about a year and a half, and navigating hospice was so difficult for him. So giving him the technology he needs, but not making it super difficult. And when his nurse came to the house, could get in touch with their provider, and my grandmother didn't have to drive him around to 15 specialists. That's one of our new solutions that we're going to be launching. Great. We're really excited about it.
Great. Was there anything else that you'd like to add for our listeners?
One important thing is if there are great innovative companies out there that want to partner with an excellent provider-led company, Inflect and Vituity and now our Healthful launch are great vehicles for people to reach out to us and get something going through either an investment or pilot. What we want to do is change the way healthcare is delivered and meet our patients where they're at.
Well, if you would, give us a website where we can learn more about Inflect Health.
Yep, that would be great. So it's inflecthealth.com and healthfulcare.com. Reach out to us. My contact info is on the website, so are my colleagues. Vituity.com, same thing. You get in touch with us that way, and we'll be there.
Great. Andrew, it's been a pleasure speaking with you this evening. Hopefully we'll get an opportunity to speak again. Thank you so much for your time.
Thank you so much. Appreciate it.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Ndrew Smith, Chief Operations and Innovation Officer at Vituity and President of Inflect Health. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.